Hi, everyone. The title of my clinical case presentation is Beyond the Audiogram. We will start off going over a little bit about the patient profile and give you some background on who we'll be talking about today. So this patient came in, he was a 4-year-old boy who was referred for an evaluation due to speech delay. Parents came in reporting limited expressive vocabulary and reduced clarity of speech. Overall, they were mostly just unsure of whether the difficulties were related to hearing or possible attention, or if it was just typical 4-year-old boy. Um, some more background on his medical history and social and family history. He was born in Ukraine full term without any complications. He never completed a newborn hearing screening, and their parents denied any known family history of hearing loss in childhood or just in general. And they also denied any history of ear infections or major illnesses. So otherwise, he is a very healthy 4-year-old boy. The primary language spoken in the home was Ukrainian, and he is the youngest of 8 siblings. Parents reported some speech concerns in a few of the older siblings, but no formal speech or hearing evaluations were pursued for any of their other children. So when we tested him that day, we got some objective and subjective data. His temps were normal, type A. His eardrums were moving the way that they are supposed to. Cochlear studies, we got absent cochlear emissions in both ears. And when we were doing behavioral testing in the booth using CPA, we found bilateral mild to moderate sensory neural hearing loss. And this was confirmed over multiple visits because sometimes kids can be a little inconsistent with their testing. And so we wanted to make sure that this was accurate and true. And so it was confirmed over a few appointments. Based on those findings, the next step was to be fit with bilateral hearing aids. The parents were on board, and we were able to get him in to see ENT to get medically cleared for those hearing aids. We got him referrals to early intervention, speech therapy, and genetics as next steps after getting this diagnosis. And so here are some discussion questions to go over. What do you believe the final underlying diagnosis based on the information presented? What was the referral, or was a referral to genetics warranted at this stage, or would you have approached the workup differently? What do you anticipate happen next following the genetic evaluation? How would you approach long-term management and counseling for this family moving forward? And at one point, if at all, would you consider discussing CIs with the patient and family? So the point that I'm leaving up to you guys to figure out is kind of his outcome. So what does his prognosis look like going forward with these hearing aids and all of the referrals that were made? And I look forward to hearing your guys' thoughts. Thank you.